Hi, I'm Megan Richards. I'm a family nurse practitioner with Community Physician Network since 2018. I like being able to care for families as a whole. I mean, being able to know their grandparents and their aunt and uncle and just kind of knowing their background. It's more longevity of care and nice to understand, their whole self and not just what they're in for the day. I think that care should be more patient-driven. I like to describe myself as the bus and they're driving the bus. I'm just there to help them hopefully get to where they need to go. So I always start with what, if they come in with a problem, what is your goal? What do you want to get out of this visit and how can we help you do that? I feel like it's a little bit better if the patient's invested in their own health and doing things the way they want to do it and not feeling like they're being forced or coerced into one way or the other. So I'm just there to answer questions, give recommendations, and help them get to where they want to be. I'm in Greenfield Family Medicine Care on the east side of Indianapolis. It's a little different, I think, compared to some of the city-based clinics that we have. It's a more rural area, a lot more farmers, but a lot more families. And so it's nice to be able to have that small town connection. You see people out at the grocery store, they're members of your church. It really makes you invested on what's going on in your community. I like that Greenfield Family Medicine Care is a really big teamwork approach. So we have 3 doctors and 2 nurse practitioners, and we see each other's patients when we need to, really try to make sure that there's no gaps in, people's healthcare due to schedules or timing. And I think that's kind of special the way that we work there. I was a pediatric nurse by trade before I went back to school, so I really love caring for kids from newborn on up. I love adolescent years when you're really starting to empower them about their health care and taking an active interest for the future. So I would probably say that's my favorite part about family practice and the area that I feel most connected to. Well, I'm married for almost 8 years now, and then I have 2 little boys. One is 2 years old and one is nearly 5. We spend a lot of time watching Reds baseball and Cincinnati Bengals football for me, Colts for everybody else in the family, and just, enjoying each other's company. I like to be that person who helps people navigate their health. It's hard, having all these things out there. There's social media now. There's all different kinds of ways you can go in your healthcare, but being able to help people start early or get on top of something that's been bugging them for years and turn their life around is really nice. I'm Megan Richards. I'm a family nurse practitioner with Community Physician Network since 2018.